from the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back into Channel 7 Daybreak. Today is Wellness Wednesday. It's the final day of the month of March, and we've got Dr. John Allen Cockerell from Sherwood Family Medical Clinic from Baptist Health joining us this morning. And Dr. Cockerell, we're talking about something that is an awareness, and we're talking about Colon Cancer Awareness Month, which is the month of March. Even though it's the final day of March, it's never too late to talk about something that's so important that affects, unfortunately, far too many people. So we've got the 5 ways today, 5 steps you could take to avoid developing colon cancer, hopefully, in your life. First of all, thanks for joining us, and let's go over those 5 steps since we have so much to get to today. Starting with a healthy diet. I feel like we say this for so many things, but for colon cancer, this really is crucial.
Absolutely. And colon cancer is one of the most preventable forms of cancer that we have. So these 5 tips, and we will go quickly. There's much more information on these items, available at the Baptist website, other websites as well, or your doctor's office, clearly. But quickly, yes, with dietary changes, one thing we see significantly with improvement in terms of risk of colon cancer is high fiber diet, right? So high fiber diet, green leafy vegetables, and less red meat. So everything in moderation. But if you can avoid the red meat or limit the red meat, increase the fiber, those things can definitely help.
All right, now the next one, get moving. And we talk about exercise often too. It feels like those two, healthy diet and some form of exercise, go hand in hand. But how does this affect preventing colon cancer?
Absolutely. So we know actually with just routine walking, moderate exercise, 30 minutes of walking 5 days per week, or even more vigorous if you're able to, significantly improves blood flow, reduces cardiovascular risk, also reduces the risk of colon cancer. So simple things can be done. Easier said than done to diet, exercise, those things, but little pieces over time do matter.
And segueing both of those into having a healthy weight and how that balance of those two things can hopefully lead to that healthy weight, correct?
Sure, absolutely. So, obesity and truncal obesity specifically, so around the midsection where you're carrying excess weight, and I need to do a better job in this regard too. So I speak from no stance of perfection, right? But truncal obesity does increase the risk for colon cancer, other GI cancers as well. So keeping the BMI, the body mass index, more reasonable, helping to lose weight does absolutely help prevent colon cancer as well.
Now, with time purposes, let's go ahead and combine these last two, but limit alcohol and don't smoke, which I know you preach often. And then following the screening guidelines, if you could go to the screening guidelines, what are those? I know they update them pretty frequently. Sure. What can we tell our viewers about screening and what they need to know?
So you've heard me say this before, but USPSTF, United States Preventative Service Task Force. It's a mouthful. I know we're going quickly. Screening guidelines are updated on that website. That's what a lot of doctors use nationwide. The American College of Gastroenterology starts at age 50, although we are researching that to maybe do this sooner. Colonoscopy is not the only way to do this. There are other ways, including Cologuard test kits at home. Yes, stop smoking if you're smoking. Easier said than done. Please talk to your doctor. Right, limit the alcohol content. Yes. In terms of screening guidelines, though, we're all playing by the same set of rules. Ask your doctor what those may be. Typically starts at age 50, and we go from there.
And your doctor knows you best. If you'd like to get to know Dr. John Allen Cockerell or the fine folks over at the Sherwood Family Medical Clinic, you can always contact them at the number on your screen or any Baptist Health Clinic at 1-888-BAPTIST. And Dr. John Allen Cockerell, thanks again for taking some time with us this morning.